My name is Nkem Umez-Eronini. I'm a consultant urological surgeon here at Ross Hall. My NHS practice is based in Greater Glasgow, so I work actually in all 4 hospitals at the moment, and that involves essentially doing minimally invasive surgery and general urology, so they're my main interests. The practice here is based around a lot of general urology, so people that have symptoms from the urinary tract, either in terms of pain or function in some way, they're having trouble holding water or having trouble passing water, particularly with prostate problems. So that accounts for a bulk of the referrals that come to me, and they come via patients directly, sometimes through the GP. I also do the specialist interest stuff here as well, and those referrals normally come from colleagues. So that would be people that have stones, people that have renal surgery that need keyhole surgery. So the slightly advanced things also. I think my main interests have always been looking at doing minimally invasive treatment. So anything that reduces the trauma of the operation and allows you to come back to normal function fairly quickly. So, you know, anything that involves keyhole surgery I'm involved in, doing operations through telescopes rather than making cuts. So actually a lot of the stone treatments that we do, and we've just started these treatments here in Ross Hall, is treating stones with lasers, and that works pretty well. I think in my NHS practice, I've pretty much trained and used most modalities to treat prostate in a minimally invasive way. And the other exciting thing recently, we're embarking on a new treatment for prostate using steam. Again, that's a short, sharp treatment that hopefully will be just as effective in the sort of medium term for people that want to avoid major surgery. So a lot of the practice is around that. The majority of patients are referred in either directly or through their GPs. I have a clinic once a week, and I think for things like stones it's ideal because I can usually get most people seen and scanned on the same day. For the majority of things then we would either then organise tests that they need, like endoscopy, looks into the bladder, or schedule surgery here. So it's a fairly slick service. It's a good place to work. It's a very fine balance between having, you know, the niceties of working in a private environment, but also knowing that you're fully backed up in terms of colleagues and things like having a HDU in case people are unwell and need a higher level of support, which isn't something that you see in a lot of the private hospitals. So I think between that and the fact that you're surrounded by a good bank of people, it's actually quite a good environment.